everybody. Dr. Molly Hart here with Pelvic Balance Physical Therapy. So today we're going to be assessing what an upslip or a downslip is for your SI joint. But first I want to get into what the SI joint is, why we need to understand these principles and what they mean for reducing your pain and increasing your function. So here is my pelvis. And with our pelvis, we've got three main joints. We've got our front joint, which is our pubic symphysis. And in the back, we've got these cool joints called our Sacro-Iliac joints, SI joints. And oftentimes, people will think that they have low back pain or hip pain. In all reality, normally, if it's in that specific area, it's actually the SI joint that is causing this pain. So, it's very misdiagnosed, and a lot of times people do not know how to treat it. Therefore, most of the time when people will get this, if they go down the traditional medical system, they will end up getting far worse because the medical system will do images, they'll do injections, they'll give medications. They don't really tell you what to do. Then, if you do go see a pelvic health PT or a physical therapist in general, or even a chiro, we're wonderful, but hopefully we're wonderful. But we again can only do your treatment right then and there in the office. So what are you going to go get adjusted multiple times a week to stay in quote unquote alignment? That's absurd, and it's not realistic, and it's not financially affordable. So what I have found is that if I can teach you guys how to assess your own pelvis and your own alignment and do muscle energy techniques, also known as MET, muscle energy techniques, to use your own muscles to pull on your bones, shift things, and make things more balanced. So I'm going to use the word balanced with this because it's not all about quote unquote alignment. But one thing I do want to make clear on why this is so important. This pelvis is a little ring. Okay, it's a ring. It goes all the way around, and at the bottom we've got our pelvic floor muscles, right? That's what's supporting everything. But this ring has to spread forces out appropriately. So if I've got my two, here is where my hip bone is at. So my hip is right here, and my legs are going to push into this. And then that force from when I'm walking, let's say, or when I'm sitting, that force needs to evenly be distributed through this ring up the spine. But if we have little shifts in the body, most likely because of muscle imbalances, meaning maybe some muscle weakness or some length in the muscle because it's not very strong, or maybe the muscle's too short because you don't stretch enough. When we have these imbalances with our muscles and our connective tissue, it can pull on this ring a little bit, and it can make things shift, and that can cause pain. Now, here's one thing I want to make very, very clear. These techniques I'm going to go over, they work phenomenal. But I also want to make it clear that we don't need to be overly obsessive and concerned about, I have an upslip or I have a rotation. A little bit of changes in the pelvis is okay. It's normal, it's safe. And it doesn't mean just because you do have shifts in there that you're going to have pain. So oftentimes the way I want you to think about it is with the whole human body. I don't care if it's the SI joint or not. Pretend you have a cup, and your cup can only be filled with so much water. And if it gets filled up more, it overflows. That's our human body. So we are the cup. And there's certain things that are going to fill our cup and kind of take away from our energy and how we feel, and kind of add more danger to that cup. We can tolerate a little bit, but if we add too much, it overflows. So what do I mean by that? My cup, for instance, I don't really work out a ton with running, but I can go run maybe like 2 miles. Okay, I can handle that because I have some room in my cup. And then I can handle some stress from work, or some relationship difficulties with my husband, or some stresses with my child because they're having difficulties at school. Maybe I can handle those things. But if I get too many things at once on my plate, it's going to go in my cup and it's going to overflow. And when it overflows, it means that things are now in this fight or flight state, and we have too much danger and not enough safety. And when I have too much danger in life and not enough safety, I'm typically going to have an output of pain, depression, stress, anxiety, something kind of negative. And that's where pain falls in. So we have too much in our cup and we're overflowing. So how does this relate to the SI joint? The SI joint being a little bit tweaked and out of alignment per se, a little bit shifted. If your cup's already full and you already have some autoimmune things going on and other health concerns, stresses, financial difficulties, and now you also have that, it's just that last little thing that overflows the cup. But then it stays there and it's irritated because it's a weak spot. It's a spot that's where my danger likes to manifest. That's where my toxins like to manifest. That's the way I want you guys to think about your SI joint. So it's your weak spot if you're having pain in it. My knee, I had a meniscus injury and an ACL tear. That's my weak spot. When I overdo things, guess what? My knee hurts. When you guys overdo things, whether it's with activity, whether it is with stressors in life, whether you're not sleeping good, you're not eating properly, you're not doing enough stress management, if you guys have all that going on in life, guess where you're probably going to start to feel some discomfort again? Your SI joint. So the pain's going to keep coming back over and over and over again, despite the fact that maybe it did go away for a little bit, despite the fact that maybe you're taking medications that are calming it. Another thing too is us women, we get pregnant, right? And when we get pregnant, that really makes some serious changes in here. A lot of changes. And then I'm in my postpartum state and I've just gone through labor or a C-section, and now we've got all these changes. So life happens essentially. And as life happens, your SI joint might get a little bit irritated. What I want for you guys is to understand that this is normal. And even I get a little bit of irritation in my SI joint at times. I just know how to correct it. So when it happens, I fix it. My colleagues, who are also pelvic health PTs, one was just pregnant. She had a massive upslip that we're going to go over here in a second. And she had so much pain during her pregnancy. But I would work with her every time and get her back in alignment and balance out the ring. And she would feel good until it slipped again, in the sense of it shifted because of the fact that she was pregnant and things were moving around. But we were able to manage it, and she knows how to manage it herself. So if I can teach you guys right now, which I'm going to do, how to assess this yourself, and then I want you guys to then treat yourself, you won't need to worry about having a PT or a chiro adjust you. Now, can you? Yeah, wonderful. But now you know how to do it. And when you're irritated from maybe going for a walk or just irritated when you wake up, you're going to do this assessment on yourself, and you're going to figure out what's wrong and what to do. And you're going to keep doing that. And then you're going to start moving more and hopefully start working out more and strengthening your glutes. So that way, if I strengthen my glute muscles and I stretch certain other muscles, I can now keep it in a nice, beautiful ring. We can't keep it in a nice, beautiful ring if we're in pain that prevents us from exercising and from doing our stretches. So you see, when you have pain and it prevents you from doing the things that you need to do that are going to keep it stable, we have a problem. So I need you guys to use these techniques every day, especially if it's irritated. If it's not irritated, fine, leave it alone. Do these every day, keep it in a good alignment position, start to strengthen your muscles in this nice, beautiful, balanced position, stretch your muscles that are too short, and then you will find you will be able to get rid of this pain, and it'll be something that you can manage. So now you got rid of it once. Let's say you get pregnant. Oh no, it's going to come back. I'm fearful. That's okay, because you know what to do. And then you're going to redo these techniques that I'm going to teach you. So today, let me just tell you, there's a couple techniques that I need to teach you because there's some different stuff that can happen at the pelvis. And it can get confusing, which is why you have these videos that you're going to watch over and over again. So that way you can learn these techniques, because they are a little confusing. Even as a pelvic health PT myself, it took me a while to learn these techniques. And then it also took me a while to learn what worked and what didn't work and what was getting results and what wasn't. So what I'm giving you guys essentially with this course this week is I weeded through all the crap. This is what works. This is what you need to focus on. Let's get started for today. We're going to go over just one technique today of assessment and treatment. Tomorrow we're going to go over a different one. Wednesday we're going to go over a different one. Thursday we're going to go over a different one. Friday we're going to put it all together. So for today, let's go over some simple basics. There's some landmarks on these bones that I need you guys to learn, okay? And I'm gonna show you on my model, and I'm gonna show you on my body, so you see both, okay? And if you want, while we're doing this, go through it yourself while you're watching. One of the most important landmarks that I want you guys to learn is this landmark right here, this little pointy landmark. We call that, for short, the ASIS. ASIS. Anterior, it's the ASIS. That's all I really care for you to know. And what I really care is not that you know the wording of it. What I care most about is that you can find this point on both sides, because these points are going to tell us where your pelvis is and alignment and how we're going to fix it. Okay, so that's one. And now I'm going to just come up real close. Do you see how this kind of has a shelf here? We have this point and then it drops down. So we're going to go over in a second on my human body, how we find that. That's one point. The other point that I'm going to have us find is actually this shelf right here. Okay, so we're actually going to be able to find and put our hand on top of this ilium right here. So then we call this the iliac crest. So the iliac crest we're going to be able to find, and we're going to look on both sides how that looks. The last thing that I want you guys to learn today is the pubic symphysis. The pubic symphysis is right here, okay? This is the pubic symphysis joint. We are going to be putting our hands, our thumbs specifically, right on the top of this shelf. And I'm going to show you where that's at. It's right above the bladder, and you'll feel it. It's a nice little shelf. And I need you guys to be able to find this landmark because I want to know if things are shifted around here, because we got a joint here. So the pubic symphysis is one area that we're going to feel for. We're going to feel for the ASIS, this little point, and we're going to feel for the top of our crest. Okay? Now I'm going to demonstrate on my body. So the reason why I have just my sports bra on is because I want you guys to see what I'm doing. So before we do any assessment or any technique ever, you're going to do one thing. I want you to always do this position, lying on your back with your knees bent, and I want you to do a bridge. You're going to lift your butt up off the mat, you're going to come back down, and you're going to lightly let those legs kind of fall out. Why do we do that? We do that because if I lay down and I'm kind of crooked like this, and so forth, and then I go to assess, I'm not going to get a good idea because I'm just like kind of being sloppy about how I'm laying here. But if you want to go do a bridge, you're going to get in better alignment. You're going to get yourself in position, pop that butt up, come back down, and fully let those legs fall out. Okay? That's going to be the first step for everything we do this whole week, is you're going to do that bridge. And I want to make that clear because it's an important step I don't want you to skip. So now, how am I going to find the top of the crest? If I bring this back here, here is my pelvis, and what that looks like right now on me is this. That's what it looks like, okay? So I'm gonna find the top of these crests. The top of these crests on me is right here. So you find your ribs, go right below those ribs, find this crest. Now what I want you to do is I want you to put your hands here, and I want you to look and see, are they level? Is one higher than the other, or is one lower than the other? So do that right now, and then look up and see what you see. Now me personally, mine are nice and level. If you're having a hard time visualizing this, take your phone, find a way to get it on top of you to record, and do it with it recording on top of you. If you can't look up and see what it is that you're doing. You can also have a mirror nearby that's above you in some form or another that you can use to see what's happening. So just get creative. I promise you it's not too difficult. So that's number one that we went over. Now number two, remember we're going to go over ASIS, this point right here. Anterior superior iliac spine. Okay, so how do I find that? So I found my crest. I'm up on top here. And now I'm going to take my index fingers and I'm going to roll them on this bone here. I'm going to roll them down, I'm going to roll them down, I'm going to keep going until I find a point, and now I hit it. Right here, I hit it. So you see my belly button's here. I'm a good almost 2 to 3 inches below my belly button. I found this spine, this little bump. So it's kind of smooth right here. It just like feels really round, round, round. Boop, I hit that spot. Once I find this spot, I'm going to look up and see 2 things we're going to look at here, okay? So for right now, what I want to know is one higher than the other? Is one closer up to the chest and one closer to the feet? That's one thing we're going to look at. The second thing that we're going to look at is one closer to the ceiling and the other one closer to the floor? So there's two things we're looking at here. One thing I'm looking at is one higher than the other? Is one closer to my chest and one closer to my feet? Or is one closer to the ceiling and one closer to the floor? So there's two different things that can be happening right here that I can gain from touching this little bony landmark right here. So grab that spot with your fingers, look up, and I want you to assess what they look like. So as I look at mine are even right now. Now, if you were to do this, and you would notice this, and this one was slightly higher, I want you to then take note of that. So we're going to take note of what side is higher. Is it my right side? Is it my left side? Take note to what that is. And then you also have the note of, was one of these higher? Okay, so one of these sides might have been higher on the top of this crest. We come down here. Which one of these is higher or lower? And then also, is one closer to the floor and one closer to the ceiling? Okay. Next, so we started up here, we went to there. Now we're going to go down to that pubic symphysis area. So we started here, we went to here, we're going to come down to here. And I'm going to put my thumbs on this tissue. So I'm coming down, I go right by that bladder. There's a big bone right here, and I come and I find the squishy tissue. So I find the hard bone, and I come off and I find this squishy tissue right here. And what I want you to do with this is you're going to use your two thumbs, and you're going to push down. And you're going to really put one thumb on each side. What that's going to look like. What that looks like, what you're doing is you're laying there, you're putting one thumb here, one thumb here. So if there was a shift, pretend I have a shift, do you see how I would be able to notice that? So don't put your thumbs directly right on top like that, but try to get them right on these little crests right here. Okay? Okay, getting back in position. I find that spot down here. Do my bridge. I find that spot. Now here's what gets tricky. If I go sit up to look at this, I'm going to engage my core and I'm going to pop my thumbs off of that bone. So this is a little bit harder to assess. So what I want you to do is put your thumbs there, dig deep into the tissue, and gently look up and see, is one side higher than the other? And I'm looking at mine right now, and it does look like my left is actually a little bit higher. Let me relook at my pelvis here. So right now, for me, this side is actually slightly elevated. The left side, let me do this again. So my left side is slightly actually higher. It's not huge, but it is slightly. So that's the things that you're looking at. So those were our three. The crest, the ASIS, the pubic symphysis. You collect that information. Now, let's analyze what that information means, okay? And I want to make sure I don't get confusing here. We're only going to go over one technique today. You might have some questions after today. That's okay. We're going to cover it tomorrow. So, if I did this and I assessed here, and my left, let's just all go with the left side here. My left side's higher, and then I go to my ASIS, and my left side is also higher, and then I go to my pubic symphysis, and my left side is also higher. That tells me I have a left upslip. What does that mean? That means my left tissues slightly shifted upwards. Here's my tissues. It means that my left side slightly is shifted upwards. Okay, I'm just going to show it in this way. This is extra dramatic with how I'm doing this, but I'm just going to show you. Okay, slightly, the whole thing is slightly shifted upwards. Okay, that is a true upslip. Now, there's other things that can happen here. We can also have this bone, this ilium, can also be rotated forward or backwards relative to the other. And we can also have some what we call like in-flaring, out-flaring of these bones, where one will be kind of rotated inwards, like so, or outwards. You have to realize it's just relative, inwards or outwards compared to what? It just means that one is more inward versus the other, or one is out. I feel like my right is higher for the last two. So we're not going to get into rotation right now of the ilium. We're not going to get into in-flare, out-flare right now. The other thing that we have to look at eventually is the sacrum itself. This big bone right here can also be rotated. We're going to go over that Thursday. We're not getting into all of that. We're going to each day this week. But right now, we're just going to focus on the upslip. And here's why I'm teaching you this technique first. No matter what else is going on, we always correct the upslip first. Always. You correct that first, then you see what else is going on. So if in the future, once you go through this course, if you end up assessing you have an upslip and a rotation, we don't do the technique for the rotation first. We always correct the upslip, then we reassess, see what's happening, and then we'll do our further techniques. So that's why I'm going over this video for the first one. So we decided the left side is shifted upwards. Well, what's a way that I can get this then to shift back downwards? Well, interestingly enough, what we're going to do, it's actually very simple. We're just going to take this leg, and I'm going to teach you how to give it a little tug downwards to then shift this. And believe it or not, it will actually correct, and it feels phenomenal. Now, there's a way you can do this with somebody else that is very effective. But if you don't have somebody else, I'm going to teach you how you can do it yourself. You are going to need a strap that is not stretchy. I don't want you using a stretchy strap. This is a stretch strap itself. You can use a dog leash. It works the same way. Okay, so you don't need anything too fancy. You're going to tie this dog leash or stretch strap on a piece of furniture. That's it. Tie it up on a leg. So I'm going to show you me tying it over here. I'm going to make sure it's really nice and tight. I will tell you that these stretch straps are easier because they have loops all throughout, and it's just easier to work with. But obviously they cost more than a dog leash. Now remember, we just said it's my left side that's shifted up. All three of those showed me that I had a little bit of a shift upwards. What we're going to do for our treatment technique is we're going to take this left leg, we're going to hook it in here, like so, and I'm just going to let this totally take the weight of my leg. So I'm not holding my leg up at all. Okay, this is holding my leg. You can use whatever it is that you need to do this technique. All right. Now, what position do we need to be in for this to work? The position that I want you to be in is going to be, your leg is going to be slightly elevated upwards. We call that flexion. It doesn't matter, but it needs to be off the ground. So you can see my leg just swinging freely. I'm not on the floor right now. Then I want you to turn your foot inwards towards your body. So what we're going to do is we're actually going to lock out our hip joint, meaning we're going to make it really solid. So that way we're not messing with the hip joint as much. We're more so shifting the pubic symphysis and the SI joint. Okay? And I don't want to confuse you with why we're doing this, but the biggest thing is I want to lock out the hip joint. So this is more working on the SI joint and the pubic symphysis versus the actual hip itself over here. So my leg's up in a little bit of flexion. It's slightly elevated off the floor. I'm going to rotate my foot inwards. So my toe's going to point in like so. And then I am going to let my leg come towards the middle of my body as well. So you see how I'm doing this? So it's towards the middle of my body. It's rotated inwards and it's slightly off the ground. And what I'm going to do then is I'm going to back my body up until I feel a really nice little tug on my joints right now. And I'm sitting here and I'm just gonna hold and just kind of with this leg, I'm gonna push my body back a little bit. Push my body back a little bit, and this rope is tugging on my leg this way. Now you can do this exact same technique with somebody holding your foot down there and giving a gentle tug. You get the exact same results, but if you don't have somebody nearby, this is how you're gonna do this all by yourself. So I'm here and I give a little bit of a tug backwards with my body, so that way this rope is pulling my leg that way. And you can actually just sit here for a little while if you'd like to. There's nothing wrong at all with sitting here for about 2 to 3 minutes. It's up to you on how comfortable you are. But make sure you're not actively holding your leg up. That rope, that dog leash, that stretch strap, that is what is holding your leg. Okay, so now what we're gonna do is we're gonna reassess. Number one, do you feel better? Did you feel a shift? Did you even hear a pop noise? Maybe you did, because if you do hear all of that, that means that you might have gotten some shifting, and it's not necessarily a bad thing. Let me make sure. Okay, good. I was just making sure I didn't miss any questions on there. So what are we gonna do before we reassess? I'm gonna bridge up, I'm gonna come back down, let my legs fall out. Again, I'm gonna put my hands up on the top of my crest. I'm then going to see, is one higher than the other? So we said the left for this example. So is my left still higher than the right? Nope, it's not. Let me go to my ASIS. They're even. Let me go to my pubic symphysis. They're even. If you can't see what you're doing very well, use a phone. I can see right now in my phone my alignment right now just by looking at my phone screen. So there's a lot of ways you can do this if you can't physically get up easily and look at that. If they're even, wonderful, you're done. As far as this technique goes, tomorrow we're going to learn other things that I want you to assess for, but now we've at least corrected the upslip. Now if you reassess and it's still higher, do the technique again, give yourself another little pull, hold it for a good 3 minutes. If you can tolerate your leg laying like that, reassess again. I need you to get it to where your crests are at the same level, your ilium are at the same level, your ASIS and your pubic symphysis. Now, a much easier technique than this is if somebody else, like I said, does give a pull on your leg in that exact same position like I showed you. It would just be somebody else giving a little bit of a tug. This is a super simple technique that works phenomenal, and it's just a light little tug. And if you reassess and it's not fully even, give another little tug. Often when I'm doing this to somebody else, I will block out their other leg with my thigh. I'll hold the leg I'm doing this technique on, and I'll just give a little pull. But when I block out their leg with my thigh here, it prevents them from moving, and I just give a little light tug. So this is a phenomenal technique. It works it works so good. So Ashton, you got some relief now. Awesome. You might wake up tomorrow and have a little bit of irritation. Do it again. It's that simple. You keep doing this and assessing yourself. Don't overly worry about assessing yourself. I don't want you guys to always be in this thought of like, is something wrong down here? But when you're in pain and it's bothering you, these are the things that you're going to look to start to assess yourself and treat yourself. And it's going to work. And guess what? Share this with people you know who also have SI joint pain, because my mission is to keep you guys out of the medical system, because the medical system does not know how to treat SI joint properly, and the majority of the time will make you guys worse and worse and worse. And I would love for you guys to stay out of the system because you're knowledgeable and you're empowered and you can treat yourself. So this was today's lesson. I hope that you guys found it super helpful. Comment on there as you're watching this, and then I will go back and I will answer questions for you, so that way we can go over anything that you need. Bye guys, have a beautiful rest of your long holiday weekend.